We are not reopening the province. This is not permission to start gathering with your friends and coworkers. This is not the time to get complacent. I am strongly urging everybody to please continue to stay at home and limit non-essential trips and continue to adhere to public health measures so as to protect yourselves, your loved ones, and your communities. With that, I will turn it over to Dr. Heyer for any comments that he may wish to make, and then to the media for questions. Thank you.
Thanks, Dr. Yaffe, and good afternoon, everybody. I think just to reiterate a couple of the comments and hold them in a bit of a different way that Dr. Yaffe. Clearly, there's improvement. Clearly, there's demonstrative change in the numbers. But as Dr. Yaffe said, we have to continue to be cautious and aware. We've talked about a decreased number of people that have died, but people are still continuing to die. And Dr. Yaffe provided the condolences. I want to echo those condolences to the family and friends and communities that have lost their loved ones, many who have probably suffered for a period of time with the illness. Recognizing there's still 817 people in hospital. That's almost the same as the 904 numbers that we talk about as far as new cases go. And the variants are present in now approximately 7%. So as we see some potential increase in the proportionality of variants, we have to continue to follow the steps that we've taken, as difficult as they are, to continue to keep that variant number down, to keep the case number down, to keep people well, and to keep people out of hospital. All of that occurring in the context of staying home, staying safe, and therefore saving lives.
We'll go to the phone lines. Just a reminder, one question, one follow-up. Over to the first question, please.
Your first question comes from Jack Howen from Queen's Park Briefing. Jack, please go ahead.
Hi, Dr. Yaffe. I was speaking to David Fissman, who said the province misinterpreted some of his modeling last week when Dr. Williams was talking about moving March break to April. He said that his modeling showed that the province shouldn't reopen schools and then businesses shortly after, and that doing so would actually risk a major spike in variants. And I was wondering what you made of that.
Well, I know that Dr. Fissman is quite involved in the science table and one of many people who are doing excellent work to advise the Ministry of Health and the province. As you know, Dr. Staney Brown presented the modeling information at the press conference last Thursday, and that is the modeling information that we have been using at the province to make decisions. I think that there's certainly a lot of pressure to open the schools. We have increased the protective measures in the schools, and we're monitoring extremely carefully as we do it, and working closely with the Ministry of Education, the local health units, the local school boards. So it's unfortunate that he feels that way, but we are working very closely with the science table. And I think if he has concerns, he should take them up with the chair of the science table, which is Dr. Brown. Thank you.
As a follow-up, he told me that that if one of his students showed the level of understanding that Dr. Williams had, he'd be concerned about their grasp of the subject matter. Is this sort of hostility and mistrust between government experts concerning to you?
Well, I think that's a very unfortunate comment. I think that we are seeing, as you've seen over the weekend, the hostility against Dr. Hergy in Niagara Health Unit. Certainly, we've been hearing about hostility against some other chief MOHs in Canada and public health officials in the States. I mean, I think it is concerning. And, we are all doing our best to protect the health of the public. And so I think people need to appreciate these are not simple decisions. There are many factors that go into them. And having hostile comments is not helpful.